Hello. Thank you so much for joining today, and welcome to our webinar discussing pricing strategies for software-embedded medical devices in the age of big data. We work with a lot of medical device clients, and we've been seeing how, as technology changes over time, there's so much more data being collected and so much opportunity to monetize that data. This is a discussion of how to understand the pricing and business model associated with that. Before we get started in the details, just a little introduction. My name is David Levine. I am a director here of client engagement. I work closely on projects like this all of the time. Our team broadly, we are a very academic organization. We were started by Dr. Sukumar, who was a business school professor for 20 years before starting OSG. And he brings an academic environment here, and we have a lot of advanced degrees. I'm an MBA myself, for example. We're based in the US, in the UK, and in India, and we do engagements all around the world. And in the, I think, 8 or 9 years or so we've been a company, we've worked with over I think that 800 number is pretty low right now. I think it's over 1,000 client engagements, over 80 billion in revenue delivered. And while we work in a number of verticals, retail, energy, CPG, finance, most of the work we do is in life sciences and a lot in medical devices, which is our discussion today. Our process broadly is to seek out a broad understanding of how customers make choices. You know, we're really focusing our discussion today on monetizing the software and data components related to medical devices. But in understanding this question, we would really seek to broadly understand the stakeholders, the customers of our clients, and understand what are the jobs that they're performing, what are the outcomes they're seeking, the constraints they have. And that starts from broadly understanding the customer journey, what is their process every day, understanding what are the unmet needs that they face, what is important to them in trying to do the jobs that they're seeking, and where are their gaps? Where are their gaps in what is being delivered today? Where are there improvements possible? And from these inputs, we can understand and quantify the market size of a potential new innovation, and understand the price value. What is prices associated with that to capture that value? And that's the component we're going to be discussing in more detail today. From there, we have platforms that allow continuing and continuous monitoring of customers later on in that process as they continue that journey and as they adopt new innovation. And we call that product CAVI, and that can look at sales data, it can look at social media listening, things like that, for a continuous evaluation and understanding of the customer experience to allow kind of a circular process for continued innovation. That is our process broadly for sustained growth for our clients. But today we're focusing more specifically on the questions of pricing. And when we think about pricing, there's a lot of different questions that our clients have and have always had around that. Pricing new innovations. How much more would a customer be willing to pay for a new innovation, for a product improvement, for something entirely new? They want to understand how brand impacts this, how one brand might be able to price versus a competitor. How can you optimize your product portfolio? What is the optimal way to price the different products in the portfolio, or how to configure the portfolio in the first place to maximize revenue, to maximize penetration in the market? And generally, how to increase market share or profitability, revenue, meet these targets, and using price as a key lever in this. Today, we're focusing on a question that we've been getting in the past few years a lot more frequently than we have before, and that is really understanding what is the impact of technology and software and data related to medical devices. So what is the value of the data that we collect? How do we monetize this value? And what is the right business model and price point to capture that value? That is the focus today. Before we get into that in detail, it is helpful to level set and understand our philosophy on product. And we see product as not just a bundle of features, but a value proposition which extends to a holistic experience of the product, of the services associated with it, the data that's collected around it. All of these things come together to form the product. And product innovation, whether that is a software add-on or a data-related service, requires a deep understanding of the customer job to be done and the unmet needs associated with it. And when we think about the product portfolio, and in this case, it can be a portfolio of a device and a software solution, these aspects, the positioning of each of them, the value that they deliver, interact to form a solid pricing strategy. So that's the focus and the lens we're going to bring to today's discussion. As we begin, there's two fundamental concepts to think about in terms of pricing that I think help frame the idea as well. The first is very simply, and I'm sure you've seen this before, but the idea of value creation and capture. And when we think about value creation, that is the amount that a customer is willing to pay above and beyond the cost to produce of a new innovation. So whatever that is, whether it's software, data, or device, whatever it is that a customer is willing to pay beyond that, beyond the cost to produce that, is the value that's created. And price is what determines how much of that value that's created is captured by the manufacturer or captured by the customer. So we set a price that captures as much of that value as we can because we're looking to be profitable, but we also want to give customer surplus as well, so that customers feel that they're getting a good value for whatever service it is or product it is that they're acquiring. Beyond value creation and capture, the other fundamental concept that we want to discuss is price elasticity of demand. And it's a very simple concept that I'm sure everyone knows, that the higher the price something costs, the higher the price, the lower the demand. So whether that is, whether that means you have fewer customers adopting it, or if you have customers adopting less of it at a higher price. The higher the price, the lower the demand goes. And different products, different offerings, different services have different elasticities. So you have something like cola in the example to the right there, that is elastic demand, whereas price changes, the demand changes very rapidly with that. You increase the price, and you see a very quick decline, whereas you have milk, which is more inelastic demand, where people will continue to purchase even at the higher price. And I'm joined by CEO of the company, Dr. Sukumar, who can add more onto this.
Thank you, David. David, I just wanted to clarify two things. The first, the previous slide that you talked about on slide 6, the importance of understanding what drives value. And today we live in a very hyper-competitive marketplace, and you would agree that value is no longer defined in a few things. It's not about just doing something faster, better, cheaper, but that you really have to drill down into a lot of specifics. So as a result, I'm hoping that when you share a little bit more about the methodology, you'll emphasize the importance of a methodology that can help understand how value is created and what the source of that value would be across a much larger list of jobs, benefits, and outcomes that you would kind of touch on. And then the second thing, you were talking about elastic and inelastic demand, and I'm reminded of business models, and this is where the elasticity of demand can change depending on A, what the competitive set is, and B, how the price itself is being presented, or what the real business model is. And what do I mean by a business model? I'll give two different examples. When you're dealing with software, you might actually suggest that the software is at a fixed price that is paid right up front, and then a maintenance fee that is charged every year. That's one business model. The maintenance fees are typically in the 18 to 20% of the actual price, and any updates or upgrades to the software gets charged separately. On the other hand, you might suggest that the software, so while the hardware or the device itself, the medical device itself, is sold for a fixed price, and then there are service and maintenance fees on top of it for the device, but then the software that runs the machine is delivered through the cloud. Therefore, it's a software as a service, and that the charges for it are an annual subscription fee that may be driven either by the number of devices or by the number of users of that software. So business model depending on how we decide to present the price to the customer, the elasticity might change. And I think a second example would be my recollection of work I've done in the consumer packaged goods world, which might resonate a lot with some of our audience here, is to think about different consumers may react differently to price and promotion. So if presented is a discounted six-pack Coke at $2.99, limit 3 to a purchaser, as compared to 3 six-pack Coca-Cola cans, 12-ounce cans at $8.99. Now, the two may actually be exactly the same, but it is well known that some consumers react better to the $2.99 for a six-pack, and others react differently to $8.99 for 3 six-packs because they see that to be a true volume discount. So is it correct that when you talk about elasticity, that some of these things in terms of controlling for competitive effects and also understanding what kind of price and how price is presented will start to drive our thinking as we go along the choice of the methodology?
Absolutely. And we have on our next slide some language we use around that, where we distinguish between the pricing strategy and the pricing policy. And this is a really important topic to understand when thinking about add-on software or other types of data solutions paired with devices. The pricing strategy is the actual prices of the different offerings in relationship to the competition. The pricing policy is what Sukumar was just describing. This is the way that price is presented. This is the business model. Is it the entire ownership? Is it an annual license? Is it a fee for upgrade? And when you are taking an existing device in particular and layering on a software solution or a data solution, by nature, you're shifting the business model. And it's important to understand the impact of not just the pricing strategy, not just the dollar associated with it, but the way that it's presented. And we make sure that both of these things are considered in any sort of evaluation. Sukumar referred to our methodologies earlier. We like to use two distinct methodologies as we approach a question like this, so that we can really understand these two distinct aspects in depth. The ACE map is a proprietary methodology which allows you to look at a wide number of features, benefits, and outcomes. And this is really the best approach to understand in depth those jobs and outcomes. How the software, how the data is delivering value to the stakeholders. What jobs is it helping? What outcomes is it encouraging? What constraints is it lifting? The bigger picture of what it is actually doing for customers, and it may look very different from stakeholder to stakeholder. We like to pair this approach with a more or less traditional conjoint analysis, which you may be familiar with, that replicates the decision scenario. And this lets you lay out clearly for respondents, if they're given different options of different packages that deliver different features and value, how they would choose given different price options, but also business model options. So we can consider whether a $10,000 one-time fixed cost is how that might compare to a $2,500 annual subscription package, and we can see all of these different approaches interact with each other. To go in a little more in depth into the AceMap component, AceMap is particularly valuable in this case because it lets you look at a much wider range of attributes, benefits, jobs, outcomes. As Sukumar mentioned earlier, in making a decision like this, our customers are thinking about a lot of different things. They're thinking about the performance of the device. They're thinking about convenience factors. They're thinking about contracting. And AceMap allows you to test all of this, and it gets the results at an individual respondent level. And that's really critical here in this case, particularly considering a device in relationship to software, to data, because you may be having very different stakeholders that get the value from the data component of it, that really see the value in the software, than maybe the clinician that might be hands-on with the product, or sometimes even the patient. So to be able to understand how the software and data value that's being delivered, who it's being attributed to and why, understanding why this is valuable and to whom it is valuable, this gives you that granularity and that detail at that individual level to really understand where that value is being accrued and by whom. Anything to add, Sukumar, on the AceMap component?
Yeah, so AceMap is a technology that was developed out of Stanford University, as David pointed out. It's predictably shown to be the most accurate trade-off technique that allows you to understand how customers, whether they happen to be consumers or whether they happen to be healthcare professionals, how they mentally account for what really matters to them, and by emphasizing which one's more important and by how much more, and how do they want to see it delivered, David, we are able to understand the true value that they place on it. And now with price as the opposite variable that they can trade off against, we begin to actually understand the economic value associated with any improvements in either current products or new innovations.
Great, thank you. And we marry this data in the process with a conjoint analysis. And again, this is what replicates the decision choice. We can have, we can take different potential service offerings. We can take different, levels of delivery, different models, and pair those with different price points and different business models. So this is where we can see how a fixed price might compare with an annual license, how that might compare with a software as a service model, where there might be building in analysis time for the manufacturer that is paired with a data or software offering as well. And all of these things can be brought together, and we can understand to what extent each of these are preferred by the customers, the stakeholders making this decision, and how the elasticity differs at different price points and with different presentations of price. Any additional thoughts here? So all of this comes together in a market simulation. With a market simulation approach, we can understand how different offerings would compare given a competitive market that exists right now, given current competitors, current offerings, how a new offering, whether it is software, data, or a combination of these things with the device, how it would compare in terms of adoption, what kind of adoption it would receive, kind of penetration, but also given different price points and different business models. And you can see in the chart here is just a mock-up example of how you can lay out how different pricing and different business models gets different penetration and offers different revenue. So you can see where the revenue maximizing price points are. You can see which business models offer the greatest revenue. And this can be understood in terms of the costs associated with the delivering the different options. It can be considered in terms of the breadth of the offering, whether that is for a very data-intensive type of customer. It can be understood at a customer level to see how that might impact it if you're selling to a few very large customers versus a wide range of very small customers, for example. And it can also see, given different options, where there might be cannibalization, where if you had two different plans with two different business models, where people would be trading off, and maybe that's the best way to kind of maximize penetration. This really lets you lay out all of the different potential options and make a choice of both offering itself, deliver the best offering to get the best results, whether it's to maximize revenue or to penetrate across the market. We have a case study to discuss kind of at a high level how we handled this for a pretty specific question. In this case, we were looking at diagnostic software that went along with it. This was currently existing diagnostic software that went along with diagnostic devices. And in this case, it was priced at a fixed cost for a perpetual license that could be used by a limited number of people. And the question was, can this be converted profitably into a subscription model, subscription service model? So rather than selling the software once and waiting until it was obsolete to get additional revenue from the same customers, is there a way to convert that profitably into a subscription service model? And the approach here was, it was a more detailed context around this. So it was actually, we, from a quantitative point of view, used a CBC exercise to focus on that, and to understand the broader context that went into this decision making. There was actually qualitative interviews. So we had a long discussion about what it is that actually goes into the decision making, about where the budget is coming from and how what value they might see from being able to have a refreshed version of that software on an annual basis or more frequently than that, versus being stuck with a single version. So in analyzing the CBC results and the trade-off in combination with that broader context, we could show what the trade-off was, what is the price that would allow enough adoption that it would be profitable to switch. So if we switched from, say, I don't remember the specific numbers, but if we say they're paying $1,000 for a perpetual license, we could have $300 for an annual license, and that would get enough adoption that you would be profitable by making this conversion. Our client would be profitable. But also, in addition to that piece, saying where is that price point that you can have profitable switching, also what else needs to be delivered to fully realize that value for the customer, that they're not just switching between things that are either neutral or that they feel that they're now having to pay continually for something that they previously had before. We had a good understanding of what additional value needed to be delivered, what frequency of upgrades, what degree of upgrades, what additional services, troubleshooting services and things like that our client would have to deliver to feel that they were providing real value on top of just a shift in business model that would require additional payment and more frequent payment on behalf of their customers. I believe the outcome of this, they did switch to an annual license fee at the price we recommend, along with a expectation of annual increases to that subscription, so that it wouldn't be flat going forward into the future, as well as a very clear plan for upgrades for their new subscribers. Anything to add to the case study here?
Yeah, so I think we had some very interesting results here. So part of this whole piece of work was to also assess how many would convert from the fixed price to the subscription-based model. We also were able to assess what the price should be and how it should be presented between an annual license as compared to a perpetual license, as you pointed out in the software. And the most critical thing here was that in order for someone to move to an annual license, there was a certain expectation, and that expectation had to be addressed. There was a specific need, and that need was that for every upgrade, for every additional license fee paid, the customer expected substantial updates and upgrades to the software itself, all delivered through a software as a service platform. So the learning from this whole exercise, David, correct me if I'm wrong, was not only to be able to see how many would convert to the new business model, the new pricing format. We've also learned about whether we could grow the market, because now instead of a single perpetual license used by 10 customers, you actually were able to get 10 individual licenses being paid for, even though it may have been at a much lower cost. The overall total value was extracted out of this whole new pricing strategy. Would that be a fair statement, David?
That's exactly right.
So as we wrap up, and I know we're coming up to our time, we welcome any questions. But the critical thing here is the approach we take, and the approach we take is quite elaborate, includes qualitative research where we do understand the customer better, understand the customer's journey, understand what is it that they look at as being value, whether it be with the medical device itself or the diagnostic device, or happens to be with the support service, the software, the analysis, the informatics that comes out of it. And then the ability is to go in and understand how much do they value some of these elements, these specific benefits that are brought forth by a holistic experience, not only experience with the device, but also with the software and the value that the analysis, analytics, and the informatics bring to the table. And once we do that, we are now in a position to figure out what is that value worth. What is that value? How can that be priced? And what's the right business model to which you would get the maximum reaction? An important component that we want to bring along here is anytime you're changing pricing models, salespeople are not very happy about it. It's a change management exercise, and we want to be able to include them right from the beginning so that they can understand and recognize this fact-based approach to pricing and why customers are actually willing to pay, and how do they need to communicate that additional value, because communication is everything. If you can position the additional pricing or the difference in pricing strategy to the customer effectively, you're more than likely to win higher revenues by taking such an approach. So let us pause. If there are any questions you have, our names out there. If there are any questions right now, I'd be happy to answer.
So, Kumar, we don't have any questions at this point.
Okay. Very good. Thank you all. Thank you for your participation. Again, our phone numbers and email addresses are right there in front of you. If you have any questions, feel free to ask us about these. Thank you for your participation today, and we welcome any questions.
Thank you very much.